We are a network of 20 community-based health and human service organizations, all based in New York City today. The network has been around kind of informally for 30 plus years. Many of the nonprofit organizations got their start back when HIV first was introduced to New York City, when the health system, social system didn't know what to do, right? There were no services. And so as a lot of advocacy, a lot of wraparound services, and as HIV has become more of a chronic health condition, many of the organizations have broadened their servicing opportunities for other chronic conditions, heart disease, diabetes, etc., really around a chronic disease management model. And we also have a lot of substance use and mental health providers, given the overlap and in HIV, substance use disorder, and mental health. And so we are now a state-designated behavioral health care collaborative that's really kind of turned our focus a little bit to improving the quality of care for substance use and mental health disorders. So when I came to the IPA, it was January 2019. I had previously worked for an organization they started social determinants of health buzzword, right? So they had a closed referral platform that they had kind of built homegrown. And so when I got to the IPA, I reached out to them and said, I would love to use your software. Like, well, we're not using it anymore. I was like, okay, well, that's a bummer. So who else is out there doing this kind of care management referral software? And so I learned about NowPow and Unite Us. At that time, it was like, we need you in the network. We need you in the network. We need you in the network. So very early on, what I ended up doing is getting all my providers on the platform first, like let them start using it, because we're not a direct service provider. We are really kind of an aggregator. We're an innovator. We're a contracting entity. Engagewell at the end of the day is a contracting entity. So it wasn't until I just have this new contract, which is really exciting, to bring food boxes to low-income patients in New York City and treatment adherence support to patients taking medications, where the IPA staff is actually managing the clients that are moving through this program. It's like, well, we are asking questions around social need. We need a platform to be able to refer. And so it's not until just recently that the IPA is thinking about our own, how are we going to use the platform to prioritize referrals to our providers? That's one of the benefits of being in our network, is kind of this preferred network approach, so that if we get referrals or we identify a need, we're going to refer back to our own network, right? It's kind of the best of both worlds in that regard. So we have a food pantry that we have stood up with a partner called Tangelo. We thought, why not use this as an opportunity to ask additional questions? So this is where it's like, wait a minute, now the IPA is becoming a screening entity, even if it's not through the social care network, but in kind of an informal capacity. We want to be able to be prepared once we gain that trust, like, oh, they really like our food pantry, they like the services they're getting. What happens if we uncover, I don't know, transportation need, or we uncover domestic violence need, right? We're not social workers. I'm a social worker, but we aren't in the business of social work, right? So we wanted to have a reliable resource. And again, being able to respond by referring back to our own providers. That's what's so great about being in an IPA. You're a membership organization. How can we then continue to drive volume to you? So we're excited. We're just building this out now. It's like one level removed from social care delivery, but we are still needing a tool to prepare ourselves to respond to needs as they arise. I think that's what's unique about Engagewell, is that we become a behavioral health collaborative over time, but that's not where we started. We started with addressing unmet social and health needs in the HIV population. So this idea of you can't address someone's HIV without addressing housing, without addressing food, without addressing transportation. It's kind of been, that wraparound service has been ingrained in us from the very beginning. I will say some of the other IPAs that were created 6-7 years ago, they're solely focused on mental health, or they're solely focused on substance use disorder. But again, what happens when it's their housing insecurity that is contributing to their mental health conditions or it worsening? And so I do think that, I'm playing this hybrid role of being a social care network, but also behavioral health network. And we're showing that this tool will work for us. We're trying to equip our behavioral health care providers to, you get afraid to ask a question. Do you have housing? Are you food insecure? If you don't have the answer, and Unite Us can help automate that answer in many ways. So I'm hoping that behavioral health providers like mine don't shy away from these social questions anymore. Not because they didn't have answers before, but now they have a tool that can help them answer it. An older population on Medicare, where there are copays for their, and if in Medicaid, you don't have copays, but in Medicare, there are 20% of the medication costs. So if I'm going to have to make a tough decision, if I have fixed income, am I going to pay for food or am I going to pay for that copay? And that's just kind of like the classic example. But there's a lot of examples like that where you have a child who ends up in the ER for asthma. And they're like, oh, you have asthma, we can give you the medication. But if you're going right back to a house full of mold, or you're going right back to a house with cockroaches, or going right back to a house that has these triggers, it's just a Band-Aid, right? So if you're not asking what's happening at home, and for a long time, no one asked that question, because what is the doctor going to do about the mold at your house? What is the doctor going to do about the cockroach? Right now, with the 1115 waiver and all there were services out there. Don't get me wrong. There's always been remediation services out there, but the doctor doesn't know that. So they don't ask the question because they don't have the answer. So I think that's another good example of, with Unite Us, with a funding stream, these two things coming together, a doctor, a nurse, a behavioral health person, they can ask the question because there is an easier way to get to the answer and the solution.